Mutations in the EGFR gene are common oncogenic drivers in non-small cell lung cancer that can be targeted with several treatment modalities, including EGFR tyrosine kinase inhibitors. However, the majority of patients treated go on to develop acquired resistance to treatment, which results in relapse and disease progression. One mechanism of resistance which allows cells to proliferate in the presence of EGFR tyrosine kinase inhibitors is MET gene amplification. Up to 15% of patients who develop resistance to first-line EGFR tyrosine kinase inhibitors, such as osimertinib, have MET gene amplification, which has also been identified as an oncogenic driver in NSCLC. Based on preclinical studies, tepotinib is thought to be a potent tyrosine kinase inhibitor that targets the MET receptor with high selectivity. By inhibiting MET signaling, tepotinib may mitigate this mechanism of resistance to osimertinib treatment. The original INSIGHT clinical trial previously reported the potential for tepotinib in combination with an EGFR tyrosine kinase inhibitor to improve outcomes versus chemotherapy for patients with EGFR mutant NSCLC harboring MET amplification. INSIGHT 2 will build upon these data and aims to enroll 120 patients. To participate, patients must have locally advanced or metastatic EGFR mutant NSCLC and confirmed MET amplification, detected by a technique known as fluorescence in situ hybridization in a biopsy taken after progression on osimertinib, an EGFR tyrosine kinase inhibitor. Patients can start treatment following identification of MET amplification by their doctor. Patients must also have previously documented clinical benefit with osimertinib, but have experienced subsequent radiological disease progression. Other key enrollment criteria are that the patient must have an ECOG performance status of 0 or 1, a minimum life expectancy of 12 weeks, and be at least 18 years old. The study goal is to demonstrate the efficacy and safety of tepotinib plus osimertinib in patients with advanced or metastatic NSCLC and acquired resistance to osimertinib due to MET amplification. Patients will receive combination therapy with 500 milligrams of tepotinib and 80 milligrams of osimertinib orally once daily. Single-agent MET inhibition has been demonstrated to provide benefit in a retrospective study. To further investigate this, patients eligible for INSIGHT 2 will initially be randomized at a ratio of 2:1 to receive combination therapy with tepotinib and osimertinib, or tepotinib alone, until a total of 12 patients have been assigned to tepotinib monotherapy. After this, all participants will be assigned to the combination therapy. Patients receiving tepotinib monotherapy will have the opportunity to switch over to the combination therapy upon disease progression. The primary endpoint of INSIGHT 2 is IRC-assessed objective response rate in patients enrolled using centrally confirmed tissue biopsy by FISH and receiving tepotinib in combination with osimertinib. Progression-free survival, duration of response, disease control, and overall survival will be assessed, and INSIGHT 2 will also gather data on safety, health-related quality of life, and pharmacokinetics. INSIGHT 2 is recruiting patients across the US, Europe, and Asia. To find out more about the INSIGHT 2 clinical trial and where it is enrolling, as well as other clinical trials involving tepotinib, visit the Targeting MET website, visit the INSIGHT 2 page on clinicaltrials.gov, or contact medical information.